Hey, Ron, excited to have you here today. I'm excited for our audience to get to know you. For the last couple of years, we've been friends and associates, and I want to kind of ask some questions about you. Maybe I'm going to ask some questions of you that I just want to use against you later. Is that okay?
That sounds good. Fire away.
No. So tell me about your family. Tell me about your personal life. Kind of just give us a little update on kind of who you are.
Yeah. So we live in Orlando, Florida. Mm-hmm. You know, I have my wife's Haley. I have a nine-year-old daughter, Sienna. Mm-hmm. We love Florida so far, but we also love, being in the mountains a little bit of time. Mm-hmm. And then we like, my parents retired in Montana, so we go visit Montana a lot. Mm-hmm. But otherwise, things that I like to do on my time off, when I have time off, is possibly going out for running, hunting, fishing. Love playing golf. If I can get out and play 9 holes or even 18, I love that. Love being active in the church. So I'm avid in a men's Bible study, and then also active in our church on Sundays and stuff like that. So
that's great.
And then most importantly, family time. I love spending time with my family, with my daughter. She's starting golf this year, so I'm super excited about that. So hopefully she gets that bug and we can go golfing together and stuff like that. So
she has several different things she's been involved in, right?
Yeah, she was really good at tennis. So I'm trying to get her back into tennis as best I can.
Yeah.
But then she had to pick a sport this year.
Got it.
So, most of us who have kids, you're going to have a hard time going against the iPad time.
Yeah.
So she had to pick a sport. She had to pick between tennis, cross country, golf was there, and she ended up picking golf.
Right.
So that was her choice. So hopefully that she catches on to that, and then that'd be awesome to have like daddy-daughter time and go golf.
The only problem is if she gets better than you. Right?
Yeah.
That quick. So that's where I tell dads, that's when you cheat. So anyway.
It's better than horseback riding.
While. Exactly.
Because she was gravitating towards horseback riding for a while there. I was like, oh, geez.
That's an expensive sport. Well, tell me about where you grew up, and tell me about where you grew up, and then tell me about why you decided to become a physical therapist. We're really interested in that.
So I'm originally from Harrisburg, Pennsylvania.
Okay.
My family's big time Penn State. My mom played tennis there, and I ended up doing my undergrad though out by Pittsburgh, Pennsylvania.
Okay.
But after undergrad, I was like, if I'm going to go anywhere, I want to go somewhere warm. I was kind of sick of the cold weather. So when I was planning on looking at PT schools and I contemplated med school or maybe going on and do a master's or PhD in exercise science versus like physical therapy. I just knew that I was going to get out of Pennsylvania and go try something else. So I took my MCATs, but then I didn't really want to go down the route of more school plus residency plus fellowship. And then I didn't really believe in treating someone with a pill. So I kind of, I took my MCATs, I kind of interviewed physicians at the time. I have a strategy where I tell young students too, where it's, go and interview 5 people that are doing what you're doing and see what they recommend. So I interviewed physicians, and at the time, malpractice insurance was a problem that a lot of physicians complained about. I didn't want to go to school forever. So I kind of took physician off of that route. And then I didn't want to go do a PhD and master's because I didn't want to be in academia that long. So I loved the science of medicine and treating the body, but I liked where the PT profession was going towards a doctorate level education. They were going towards, research and evidence-based practice. So I decided to apply to all the PT schools from UNC Chapel Hill all the way down to Miami, Florida.
South. Gotcha. Okay.
Only warm weather was the main qualifying thing. So everyone said no. I remember the professor at UNC Chapel Hill telling me I didn't have what it took to get into PT school. And then one school gave me an opportunity, and that was the University of South Carolina. And they accepted me into their program, and that's all I needed was like one shot. So, and I ended up meeting Ray there. That's where Ray and I met.
That's awesome. So the criteria for you was warmth,
warm weather, and then see who accepted me.
Exactly. Well, no. So tell me about your experience in PT school. Was it as hard as you expected? Was it harder? Just tell me a little bit about that.
Yeah. So I thought PT school was what? So I had a good background already because
Okay.
I was a sports medicine undergrad
Okay.
with a minor in chemistry because I was deciding whether med school or PT school. So I had all my sciences already good. I had a lot of the anatomy and kinesiology and biomechanics already done. So I realized when I got into PT school that I wanted to be the best PT, not the best student. So like all the orthopedic stuff, biomechanics stuff was kind of easier for me because I already got it. So I was a server at an Outback Steakhouse and a personal trainer and going to PT school at the same time.
Wow.
So throughout school, I had my basics covered already. Yeah, like the neuro part of it was harder because that was new for me and stuff like that. But I had 2 part-time jobs and PT school, and I made it work. I still graduated like a 3.75. I still did good. So
what is a 3? I'm sorry.
a 3 points.
3 something. I never saw that number, but that's okay. That's another thing. But anyway, so you were well prepared coming into PT school. You had multiple jobs, and obviously did graduate very, very well. Something we hear a lot is how expensive PT school is. Was PT school expensive there, and how did you afford it? Did you come out with debt? I'm just curious.
Yeah, so since I went out of state, the first year or 2 was out of state tuition, so it was a little bit more expensive. And our program had a research component to it, so it was 3.5 years and not just 3.
Oh wow!
So our school pretty much was a little more expensive than most. I ended up getting in-state tuition once I kind of claimed residency there, stuff like that. So yeah, I took out student loans, typical as a normal student does and stuff like that. And I didn't manage money well either at the time. So I ended up graduating with about, most students have like anywhere from 100 to 200K in debt now coming out. Yeah. I graduated with probably about 100, 120 total. That's undergrad and grad school.
Yeah. So you understand that pain that we hear from a lot of physical therapists, that they're coming out with this debt and then they're starting, and I was just curious, and you did, by working, you were able to kind of knock that down some, but it still was there when you graduated.
I understood it because in my undergrad, my dad got laid off my freshman year. So I went into school thinking I was going to be a crim major or something, and then I flipped to medicine, sports medicine, stuff like that. My dad got laid off, and I was on my own. I was like, I had to pay for my own school. Yeah. So I was like, well, if I'm paying for school, I'm going to do the student loans. And once you see the numbers, how much school cost, that lit the fire underneath my butt. And I was like, you know what? If I'm going to have to pay all this money, I'm going to get straight A's. Wow. So I used to be a B student. And that lit the fire underneath my butt, where I got straight A's throughout all of undergrad. I was almost obsessed with getting A's, and that was my undergrad stuff. But then when I went to grad school, I knew, the student loan debt stuff, taking out student loans, how much I'm going to take out. So it kind of switched though from being the best student. Now I'm in the program. I know what I want to do. I'm going ortho sport, route. That now it became, I want to be the best PT. So I had my basis covered. I knew the debt coming in. I even switched out. It was interesting. I even took an entrepreneur class in PT school.
No, that's very unusual.
I took an undergrad. They had a way of charging like per semester, where I was like, hey, I'm interested in entrepreneurship. So I contacted an entrepreneurship professor, and he was like, yeah, you can take my class. And he let me take it pass fail. And I went there and learned a lot of entrepreneurship strategies of business in PT school, which I was taking an undergrad class in a doctorate level education too, just to learn some entrepreneurship and PT stuff. But I figured out there was no extra cost with it because it was under a certain amount of credits and stuff like that.
So you might take advantage of it.
So yeah,
that's awesome. Let's talk about the PT school. I've heard one about the issue of debt. I've also heard the issue that a lot of, and I would say this beyond just PTs, people in medicine, many of those disciplines don't do a very good job of helping people be prepared to run a business. You taking that entrepreneur class was really your way of starting to move into that area. When you came out of PT school, did you feel prepared to run a business?
Oh, definitely not. In medicine, you get there's a standard of care, like standard medicine, standard healthcare.
Yeah.
And in whether it's med school, PT school, whatever, you just get sucked into that funnel of going into standard care. And that's the way it is.
Yeah.
It's really hard to think outside the box and do things differently coming out of school because you're just so used to the norm. No one ever thought about, you don't think about, can I do it better? Can I do it cheaper? Can I increase profits? No one even thinks about it. You're just focused on, can I help this person in front of me? And what is the standard?
When did you see, or when did you know that you needed to get better in that area? Did you see somebody that was doing it really well? Or did you realize, hey, I have to figure this business thing out? Which was it for you?
My first goal coming out of school was I wanted to get good quick. I wanted to be able to handle the clinical side of things fast. So right after school, we worked for a year in standard care. Like, this is not how we want to practice. This is when Ray and I worked together. And Ray ended up going back and doing a PhD. I went and did a orthopedic residency down in Orlando, Florida. I just wanted to get good quick. Whether it's having a mentor, whether it's doing a residency fellowship, I just wanted to be able to handle the clinical side of things. So I focused on taking a lot of Con Ed courses, having mentors, learning as much as I can, doing a post-doctorate residency. After the residency, I felt that I could hang. I could have a conversation with a physician about anything. I could have a conversation about it with a chiropractor. I could have a good conversation about evidence-based practice. What is the best thing to do? And I could handle complex cases. The thing that started the shift towards entrepreneurship really for me was I was working in an outpatient orthopedic clinic, hospital-based, and this is what started Pursuit. I was treating a patient in front of me, doing some manual therapy, and there was a patient behind me, on the table behind me, doing exercises. And I looked up, and they're like, Ron, your next patient's coming in. And I knew I could have helped that patient that I was working on. I could have helped that person better. But the system and the setup, the way standard healthcare isn't working. And I had to pass that person on to a tech or an assistant, or just let them go do some exercises, and my next patient's coming in. So the way the system's set up with, all of healthcare, it's like I have to see, or in therapy, you have to see 2 to 3 patients an hour almost in standard insurance-based therapy. And I was like, man, I could have helped that patient, but the system didn't let me do that. So I was like, there has to be a better way. And then the second thing that happened was most times when you're part of a team, you have like a monthly team meeting. And in therapy, the billing happens every 15 minutes. Okay. It's called a unit. And the manager was going around, they're like, Kim, you're averaging 5 units a visit. Jane, you're getting 4 units a visit. Kim, you're doing this, you're doing that. Ron, you're averaging 2.5 units a visit. You got to start billing 4 and 5 units a visit. So I was getting penalized for getting patients better faster. At this time, I was killing it clinically. I was getting people better quicker. Physicians were like referring to me. We were having conversations on what's the best thing to do with back pain patients. I was doing great clinically, but I was getting penalized for getting patients better faster.
Right.
And I was like, this can't be the way that standard care is. I'm getting overworked seeing 2 to 3 patients an hour. And now I'm getting penalized because I'm getting them better faster. So that's what started Pursuit. I was like, there has to be a better way. And that's the story that started Pursuit, where I broke off, I quit, I went and opened up a clinic, cash-based clinic, and I went the entrepreneur route.
That's crazy. Here's a question I like to ask people, and I love to see where it goes. And again, I'm sitting in the Midwest. In the Midwest, we don't like to brag about ourselves. We are self-deprecating. So I'm going to ask you to brag just a little bit, if you don't mind. But you're from the South, so maybe you guys brag down there. I don't know. But I want you I love this. The question is, what makes you uniquely different and what makes you uniquely better than the people that are in your community that do what you do? What makes you uniquely better and uniquely different?
What makes me different? Are you asking from a clinical standpoint
No,
or
I'm talking
about
from a personal perspective. It could be a professional. I'm going to let you run with it, but I'm really saying, what makes you better? Well, what makes you different? And that's what I'd love to just get your feeling. You've already shared a few things. You shared something just a second ago, how you were not satisfied with helping. You wanted to get people better. That makes you different than what the norm is. So I'm just curious, if I said, what makes you better than most people? What makes you different than people? I'd love to know that.
From a clinical standpoint, first thing is the system has to be, you have to do what's best for the patient. That's number one, period.
And that's what makes you better and different than most?
Different.
Yep.
What is best for the patient should always dictate care, period. All the business stuff comes in after. You got to figure out that stuff. What is best for the patient, how to maximize profits, what to sell individual versus packages and stuff like that. That's a whole other thing. In healthcare, the first rule should always be what is best for the patient should dictate care, period. And you figure out the business stuff later. My approach to clinically is I like to solve the root cause of someone's pain or symptoms and then highlight underlying risk factors. So I'm in it for the long-term outcome to fully resolve someone's symptoms as best I can. Not putting a Band-Aid on someone's injury, not a short-term outcome, and then it comes right back. So first off, what's best for the patient always dictates care. Second is, can you solve the root cause of someone's pain or symptoms? And then highlight underlying risk factors to make sure it stays away and goes away. I feel that it's a simple principle to follow clinically, but it's not implemented a lot. If you can do that, you'll show better outcomes over a longer period of time. Now, a big problem in healthcare is what I stated earlier is, from a business standpoint in healthcare, getting patients better faster isn't always the best business model. I interviewed, as I started my entrepreneurship journey, I'd interview successful people, entrepreneurs, business owners, and I interviewed a venture capitalist once. And he blew my mind where it was like, in a good economy, I do this, in a bad economy, I do this. So either way, I'm doing good. But he invested in some chiropractic clinics around me. And he made the statement, he was like, we want a patient for life. And I was like, I kind of disagree with that. I believe we owe it to that patient to do what's best for that patient. Now that patient can come back and get injured again or go out and want to do preventative and other services, but I don't want a patient for life, because I believe I owe it to that patient to do what's best for them. I don't want to see the patient for one injury 2 times a week for eight months when I know I can get them better in 4 weeks. So that principle of solving the root cause of that person's pain and solving those underlying risk factors, I think it's a different model. It's a different treatment approach. And they can refer other people and they can go out and do other things or offer other services. But those 2 principles are basic fundamentals of how I practice, of doing what's best for the patient and solving the root cause. And then they can refer others. Hopefully they love the service. They love the outcome. They love the experience. And they can create more word of mouth referrals or go out and get injured again.
Yeah. That's what I keep doing is I keep hurting myself. So Ben just keeps getting me because I keep doing stupid things. So no, I love what you said about being different. I think that is really excellent, Ron. And I think, what you said at the very end, and we'll talk about it at a different time, but the idea, if you do the right thing, it's always good to do the right thing. It's always right to do the right thing. And if you do the right things, good things come back to you. They refer. So I just think I really, really appreciate that. That was excellent.
I got this quote from Ray that stood out with me for a while. So Ray always said, you choose the harder right over the easier wrong.
Say that one more time.
To choose the harder right over the easier wrong. Wow. To go do the right thing instead of choosing the easy, wrong thing to do. So
That's great.
I think one thing I've learned in business is you have to have a set of core values and business principles that you abide by. And it's important to bring the team on board to follow those same principles and core values, and you form a team that way. So it's like that's one of our business principles in Terrell, and it's one of our business principles in Pursuit. I think it's number 6. Choose the harder right over the easier wrong.
That's great. Well, thanks for letting me interview.
Yeah.
I think people will really enjoy getting to know you and the depth that comes with you. So again, great job.
Thanks.
Hey, it's Bruce and Ben. We wanted to take a moment to welcome you to our YouTube channel, Terrell Medical Education.
Terrell was created for rehabilitation professionals of all kinds to really work together to start changing the way that healthcare is currently being practiced and what the future of healthcare looks like.
We hope that our content and community helps inspire you to be a part of the next level of clinicians that are going to treat our patients out in the world today.
Beyond just joining us in our free community that we call the Terrell Tribe, you can also check out some of our events on our events page at terrell.com. Each and every one of our orthobiological hacking conferences and events and future events to come is really designed to help you really master and learn these regenerative concepts, as well as take charge and move the rehabilitation profession forward.
We're really excited about the orthobiological hacker certification, and we have much more content coming. So subscribe, check out our YouTube, check out our website, join the community, and we hope to see you at our events.
And remember, a storm is coming.
Thanks so much for watching.